Good morning. My name is Dr. Jeff Teeter, and this is Titan Health Direct Primary Care. I'm doing this video today just to give you an idea about myself and how I ended up here at Titan Health Direct Primary Care. So, way back in the day, I grew up in the mountains of Colorado, and I stayed there until I was about 12, where I moved to Colorado Springs, Colorado, to do junior high and high school. My high school years were tenuous, to say the least, and I was one of those little undiagnosed ADHD kids. So I was constantly in trouble, constantly missing school, and would never do homework, etc., etc. This ended up putting me pretty far behind, and so my senior year I ended up dropping out of high school. Fortunately for me, I took the ASVAB, or the military aptitude test, 2 weeks prior to doing so, which is a good thing because I scored among the highest in the entire region. And this gave me the opportunity to get into the military with a waiver, and my father signed me over to the United States Navy at age 17. From there, I had the opportunity to serve overseas and gain a unique perspective on other cultures, other people. The military gave me the chance to grow up and taught me a lot about self-discipline. And, I credit a lot of my future educational career and personal career to the lessons that I learned in the Navy. So shortly after I got out, I decided that, I wanted to better myself mentally instead of just physically. And I knew that if I wanted to be anything other than a grunt in this world, I had to go and gain an education. So I signed up for community college, and during my associate's degree, I worked full-time, 60 plus hours a week, as a general manager at Hollywood Video. For those of you that are young, Blockbuster Video and Hollywood Video were these places you would go to rent either VHS, these square tapes, or DVDs, and you'd bring them home to watch them. We didn't have Netflix back in the day, or it just came out and it was a new thing. Anyway, so after doing my associate's degree, I applied to Colorado State University and was accepted for a degree in microbiology. There I worked as an undergraduate researcher with Dr. Alan Schenkel, and I also worked 25 to 30 hours a week at the veterinary teaching hospital in the microbiology lab. Shortly after college, I was not quite ready to go on to medical school. Now, I wanted to be a doctor since the time I was about 9, when I had the opportunity to see and witness my mother's upper GI endoscopy. The doctor was amazing, allowed me to stay in the room, and even let me take a look through the little auxiliary eyepiece. And that was just amazing. I got to see my mother's esophagus and stomach, and I was hooked at that point. But I didn't think that anybody would take a high school dropout. I also knew the extreme responsibility that was being a physician and taking care of the lives of your patient. So I wasn't ready for that kind of responsibility. And I decided instead to become a high school biology teacher. So I worked in an alternative school in the Denver public school system. So these were kids that just got out of juvenile detention and or were expelled from Denver public schools, and this was their last chance to get a high school diploma. Wonderful opportunity, wonderful kids. But in those 2 years, I really gained the confidence to know that I could do this and I could take responsibility for the lives of my patients. And it was just a wonderful thing to experience. So I decided, okay, let's do it. And I applied to medical school and was accepted to Midwestern University, the Arizona school. And from there, I went on to do diagnostic radiology for my residency. After a couple of years of that, I remembered, I actually like people. And I would rather spend time with them than sit in a dark room for the rest of my life. So I made the decision to leave diagnostic radiology. And my wife Megan and I, moved to Fort Walton Beach, Florida, and I became a general practitioner at a family medicine walk-in clinic. That really solidified my desire to be a family medicine doctor. So we decided together that we were going to move to Jefferson City, Missouri, to be closer to family. Megan's originally from Kansas City, and for me to go back to residency. As soon as I got out here, I fell in love with the area, and we both decided very quickly that this was where we wanted to be. I hadn't seriously considered direct primary care until the last year of family medicine residency. Now, I'd been thinking about it for several years, but I started doing some research online, and I had the wonderful serendipitous opportunity to come in contact with Atlas MD. So I gave them a call and spoke with Kirk Umber, who is the brother of Dr. Josh Umber, that is the owner and operator of Atlas MD. Kirk was wonderful to me and gave me kind of a rundown of direct primary care as they knew it and their system for electronic medical records. He then put me in touch with Dr. Josh Umber, and he was incredible in teaching me about direct primary care and even gave me the opportunity to come see his clinic in person. From that moment on, I knew that this was exactly what I wanted to do. So I began planning, and 6 months later, Titan Health Direct Primary Care was born. I am honored and privileged to be the first direct primary care here in Jefferson City, Missouri, and I am really looking forward to providing the quality care that the members of this community deserve. I'm passionate about providing health care the way it is supposed to be done, as a direct relationship between me, the physician, and you, the patient. And everybody else can see their way out of our conversation. This city and this state deserves the kind of care and attention that you can get through direct primary care. And I would welcome you to come and visit the clinic, take a look around, chat with me, and visit our website at titanhealthdirectprimarycare.com, so titanhealthdpc.com, and browse through. It's got great educational videos. You can see a little bit about our practice and about my wife Megan and myself. And give us a call. We'd love to chat with you. So I look forward to speaking with you soon, and more videos will be coming.